Boothby.
Thank you, Deputy Speaker. Australia is in the midst of a mental health crisis, and I'm not going to play partisan politics on such a serious issue. The statistics are stark. 1 in 5 Australians between the ages of 16 and 85 experience a mental illness every year. 1 in 2 Australians will experience a mental illness at some point in their lives. Unfortunately, South Australia is no exception. 1 in 5 South Australians experience a mental illness every year. 43% of South Australians will experience a mental illness at some point in their lives. Chances are that you know somebody with a mental illness. It may be you. And yet Australians are more likely to seek professional help for a common cold than we are for a mental illness. And that's why Mental Health Month, which we marked in October, and Perinatal Mental Health Week, which we mark this week, is so important to bringing awareness to this health crisis. And it is a crisis which has been long under-prioritised, underfunded and underappreciated when it comes to government support. But the Albanese Labor government is changing all that with an unprecedented $1.1 billion in investment in expanding and enhancing Medicare mental health services across the community, across the country, providing tailored and targeted support for all Australians and their mental health needs that are crucially accessible and affordable, because the Albanese Labor government understands that mental health care is a right, not a privilege. The numbers speak for themselves. 91 Medicare mental health centres offering a free walk-in service delivered by a multidisciplinary team. 20 perinatal mental health centres for new and expectant parents. 17 Medicare mental health kids hubs providing early intervention support for children under the age of 12 and their families. 203 Headspace services for young Australians between the age of 12 and 25. 20 youth specialist centres for young Australians with complex needs, and support for an expected 150,000 people with mild to moderate mental illness each year with a Medicare mental health check-in, a free non-referral over-the-phone and online service led by trained mental health professionals. Funding for more than 4,000 psychology scholarships, internships and training places. In Marion, in my electorate of Boothby, we have an excellent Headspace service which is much used. Next month we will welcome a Medicare Mental Health Kids Hub in the Marion GP Plus Healthcare Centre. A Medicare Mental Health Centre will also be established in this area. Work on a perinatal mental health centre is currently underway in Elizabeth in Northern Adelaide, and we can expect at least one more perinatal mental health centre in Adelaide as part of Labor's 2025 election commitment. A new statewide eating disorder service will be built at the Repat Health Precinct in Door Park in the very heart of Boothby, providing inpatient and outpatient treatment for people living with an eating disorder. And we're rebuilding and expanding the inpatient mental health service at the Margaret Tobin Mental Health Centre at Flinders, which when completed will be able to accommodate 48 mental health beds, including 12 brand new beds in the psychiatric intensive care unit. Deputy Speaker, the metaphor of the black dog is often used to describe the experience of depression, and for while many of us, a dog is our loyal companion, the black dog of depression refers to a dark shadow that accompanies you morning and night. It interrupts your sleep, it craves your attention during the quieter hours of the day and barks even more loudly when your attention has strayed. It's the shadow on your joy, the shadow on every activity. It undermines your focus, saps your energy. Chances are that we all know somebody who is being stalked by their own black dog. Chances are there are people in this chamber, in our offices, in our families and in our homes that know the black dog or other forms of mental illness. The black dog can be kept at bay, mental illness can be treated, and as with all illness, often early intervention leads to a better outcome. And that's why the Albanese Labor government's historic investment in the national infrastructure of mental health care is so vital. It will ensure that all Australians, no matter their age, the severity of their condition or their financial circumstances, can get the mental health support they need, wherever they need it and whenever they need it. I commend the motion to the House.